I guess, especially with considering the FDA's, post-market VAERS, as you mentioned, it's measurements to assure that what's now in the field is, certainly applicable. Do we see a level of adherence or embrace of vaccines relative to what those findings show us? I guess, do we have metrics showing that people are using the analysis that certainly it sounds very robust and proven and evidenced over a long period of time? I think you said it only found that one was unworthy of being on the market and that it was thus removed. Do we see a correlation between, I guess, that sort of assessment and actual adherence to the vaccine?
So the big question is whether the large population actually cares about facts or about scientific knowledge. And we know that the vast majority or big proportion of population really does adhere to recommendations. But we do know, and our article also quotes a few studies showing that there is more and more unwillingness to vaccinate, which has led to diseases that were once almost gone from the world, re-emerging, measles, and we see the measles outbreaks. Some of them are bigger than expected. People are you tell people to vaccinate their child and it's very safe against a disease they've never seen. It's quite hard for people to understand how and why they should give a drug to their child against the ghost. They have never seen the disease. Some people have never seen polio, let alone diphtheria, tetanus. So it's hard to convince the people that are unconvinced. And as we know, fake news and lies are being widespread over the internet way faster than truths. It's easy to find data on this. And this is why, although we didn't aim for this study to coincide with the COVID, we started it before Wuhan was ever in common knowledge. We were happy to see that maybe the 30% that Associated Press quoted as unsure if they were willing to receive the upcoming vaccine, maybe some of those 30% will adhere to reality and to actual facts. I'm worried, I'm optimistic.